UK Health Secretary Matt Hancock has said another strain of the coronavirus has now been detected in the UK, which has originated from South Africa. According to Matt Hancock, the recent development is highly concerning as this new variant is highly transmissible and appears to have mutated further. Listen in to the remarks that he made just a short while back.
Across the country, cases have risen 57% in the last week. The average COVID hospital admissions are 1,909 a day. That's the highest figure since mid-April. There are 18,943 people in hospital with coronavirus right now. That's almost as many as there were at the peak. And yesterday, there were 691 deaths reported. That's 691 people who have died just before Christmas. And our hearts go out to their families, their loved ones, as with all who've died from this horrible disease. I know the pain that this causes. So against this backdrop of rising infections, rising hospitalizations, and rising numbers of people dying from coronavirus, it is absolutely vital that we act.
Encouraged and humbled by the...
Now, there are two mutant strains of the coronavirus circulating worldwide. One that originated in the United Kingdom and another from South Africa. The UK has been struck by both these strains, forcing the government to impose even tougher restrictions. All travellers from South Africa coming to the UK over the last 2 weeks have now been asked to isolate immediately.
Some developments about another new strain of this virus. Of course, the fight against the virus is a global effort, and we're constantly vigilant and looking around the world. And as part of our surveillance, and thanks to the impressive genomic capability of the South Africans, we've detected 2 cases of another new variant of coronavirus here in the UK. Both are contacts of cases who have travelled from South Africa over the past few weeks.
Joining us for more on these developments is Ollie Barat from London. Hi, Ollie. Matt Hancock has given out those list of measures that the UK is putting in place now that a second mutation has been detected in the UK. Tell us more about this mutation from South Africa, and to what extent is it more transmissible as compared to the strain detected earlier in the UK?
Well, a lot of that is still unclear at this stage because the scientists are still in early stages of looking at all of this. There is an advanced study of what this new strain looks like and how transmissible it is in South Africa, but even there scientists are still learning. They were able, though, to tip off UK officials about the potential presence of this new variant in the United Kingdom. And now that 2 cases have been found, given that it is at this point just 2 cases, the hope in the UK will be to keep it at that number with the travel restrictions that are being put in place on South Africa and the quarantine measures that are also being put in place here in the UK on anyone who's been to South Africa recently or who has been in contact with anyone who has been in South Africa. So the aim will be to keep that newest variant completely under control here in the UK in a way that has not been possible with the other new variant that had been discovered some time back in Britain and is now spreading rapidly.
Hospital admissions at an all-time high in the UK. There has been an over 50% increase in cases as compared to the last week. How prepared is the UK to deal with this fresh challenge?
Well, government ministers say that they are well prepared. Hospitals are ready. There's extra capacity if required. But we have seen a number of hospitals in recent weeks, really getting right up to capacity levels. So the fear, of course, is that if case numbers continue on their current trajectory, then you will see rising hospitalizations and you will see more hospitals becoming really, really stretched and perhaps some becoming overwhelmed. The government will endeavour to make sure that doesn't happen, and the National Health Service here in Britain has not been overwhelmed at any stage yet during this crisis, and the government will certainly want to keep it that way. It will all depend on the size and the scale of the numbers that we see over the coming weeks. The government and scientific advisors have always been very worried indeed about this time of year, which is always the busiest time of year for the UK's National Health Service, the winter flu season, other illnesses and diseases that are more difficult to treat at this time of year as well. So add all that together and it's a precarious position.
The mutation that was earlier detected in the UK is believed to infect children at a higher rate as compared to adults. What more do we know at this point?
Again, not much. Scientists saying it may be the case that that is true, but they're really not 100% sure to the extent that it is true, and therefore exactly what needs to be done about it. But it is raising further questions about whether schools in England will return for the start of next term as planned in January. Boris Johnson, the British Prime Minister, has always called it a national priority to keep schools open as much as possible. We heard from Jenny Harris in the press conference, the Deputy Chief Medical Officer at Downing Street just now, talking about how the public health implications of taking children out of school are things that they feel not just in the immediate future, but for the rest of their lives. So the government does want to keep children at school if possible, and there's going to be extra testing rolled out for schools when they do return, presumably in January. But rising questions about whether that is the right thing to do, if indeed this new variant is spreading more quickly in the school setting.
Leaving it there for the moment, Ollie, thanks very much for those updates.